Lorian, take it away.
Okay, we'll be starting on page 199 for public safety. I'm going to hand it over to Rusty Leeds.
Rusty.
Good afternoon, Commissioners. Welcome to Public Safety Division's 2026 Budget Reveal. Today, you're going to hear from 8 departments, and you're going to hear about the Crime Prevention Fund. You're going to hear and see requests for about $4.4 million in new spending. Some of it's one-time expenditures, and many of these requests are recurring and perpetual expenses. You're going to see a recommendation to reduce about $156,000 and a recommendation for a revenue enhancement of about $89,000. And where's the clicker? This is the overall division workforce status. As you can see, our workforce is healthy, and that is largely thanks for the competitive wages that have been provided by the Commission post-pandemic. Also, the quality and affordable benefits that the county generally provides to employees, and also for good work environment. Equally important are to the healthy staffing levels. They provide good work-life balance for employees, and they help facilitate work and life balance, as well as personal wellness for employees. And it also allows our department leaders greater flexibility and opportunity to support and administer employee development and quality improvement initiatives, which just further enhance work environment and employee longevity and wellness. So having a good, healthy workforce provides a lot of benefits. Having good competitive wages helps keep the workforce healthy. All of these things collectively translate into quality public service, quality customer service, and good productivity. So with that, you're going to see the 8 directors come up each in their turn to provide their budget to you. I want to stop for just 1 second for all the directors and leaders in the room. Mr. Scott Wagner, if you'd stand up briefly and just wave your hand, look at the people behind you. This is our new Chief Information Officer. So this is his third day. Yep. This is his 3rd day at work. So put the name and the face together, and that's your new CIO, just so you know. With that, we will get started with the first department, and that is going to be Dr. Kevin Brinker with the Office of the Medical Director.
Hi. Lauren, do you have a page number?
201.
201. Okay, Dr. Brinker, welcome.
Welcome. Thank you. I'm Dr. Kevin Brinker, the medical director for the Office of the Medical Director, the Emergency Medical Services System. We'll present our budget this year. It's going to be pretty brief. I requested no decision or revenue packages, so we'll get started. I have 3 employees. We're fully staffed and have been. There's myself, Derek Ruddle, my program director and manager, and Scott McBride, who's our credentialing specialist. We have mandatory and here it is. Okay, if I go there. Okay. These are the mandatory and non-mandatory services that we provide. We provide medical oversight for the emergency medical services system. I maintain and establish and change from time to time the scope of practices for each of our credentialed providers here in Sedgwick County based on state requirements and guidelines. I provide medical oversight and quality assurance. I oversee the medical education and credentialing for all of our first responders here in Sedgwick County within the system. And then I approve and review all of the credentialing tests, the training programs, procedural programs, and that are utilized by our first responders. The non-mandatory services that I provide is I attend many committee meetings at our systems hospitals. I'm also the director for the Hutchinson Community College paramedic training program, which is a feeder for the E2P program. I'm also the medical director for the Kansas Emergency Medical Services Association. I'm also an adjunct professor preceptor for the osteopathic school here in Wichita. I'm on the EMS advisory board for the Hutchinson EMS program through the college. And I'm also an active member at the state and local level and nationally with the National Associations of EMS Physicians, the Registry of Emergency Medical Technicians, and the EMS Quality Alliance. Our 3-year horizon of strengths, weaknesses, opportunities, and threats. We recently, within the last year, implemented a new set of formatted protocol, some procedural and medication changes, which have so far dramatically decreased the number of medical errors that I receive. We're still waiting for the fourth quarter to come in so we can kind of evaluate that to get a percentage of how well we've done. But I know that the items that are coming across my desk are dramatically decreased. I provide medical oversight for the law enforcement Narcan programs and also EMS's Leave Behind Narcan program, which we initiated in the last few months. The LEO Narcan program has been initiated that shortly after I came on back in 2021, 22. We recently had an influx to purchase new training equipment, which I greatly appreciate from the commissioners, which is going to provide us essential equipment for future training endeavors and allow other services within the system to utilize our equipment for their training needs. And we are also unique and small enough that we can provide individual and large and small group training programs when necessary. Some of our weaknesses, we have one aging vehicle that limits the outlying, which limits the availability of our system credentialer to do on-site credentialing and testing at some of our fire stations. And we generally have to bring them into OMB, which can be a little bit cumbersome. And with anything, current funding kind of limits our expansion and opportunities. Some opportunities in the future. I think a whole blood program is headed our way. I think it's necessary. There have been some challenges with that recently with leadership changes with the surgical departments at HCA and Ascension. We've overcome those. I've had meetings with them, and they're all fully on board. With that, we need to implement an ultrasound program for diagnostic purposes for abdominal injuries, lung injuries, line placements, and that sort of thing. And then I'm working with Wesley to develop an extracorporeal membrane oxygenation program or ECMO program for select cardiac arrest victims. That we can transport to their ECMO lab. They can be essentially placed on bypass and they can fix the problem, which we're seeing substantial success with in several locations, including Milwaukee and San Diego County. And then we have Pulsar in place, although not, which is an early activation for STEMI, which is not being moving towards its full potential due to limitations with HCA upgrading and purchasing the equipment and that sort of thing. I think, and then we have an opportunity for the community paramedicine program. If we use it effectively for some of these patients through the HCA, through our system hospitals to kind of follow up on some of their patients, are high utilizers. And there's also an opportunity to develop a buprenorphine or Suboxone program for initiation of select overdoses that we see until we can bridge them into a treatment program. Our threats, as you know, it's always funding, continued budget constraints, rising equipment costs, availability of medications and costs, and access to certified providers in the future. Is what we're seeing is a lot of the providers that are coming into the paramedic programs are already assigned to other agencies. So there's a limited pool of that level of certification. Okay, moving into the budget, as I've mentioned before, I've not put in a decision package this year due to the influx of funding for new training equipment. I think we're in the budget constraints this year. We are sustainable for a time being, and I think that that's why I did not submitted anything along those lines. Our budget has essentially gone up about $1,000. I think we can maintain that. The bulk of my budget is personnel costs and keeping daily functionality with certain programs that we purchase and paper, lights, that sort of thing. As I've mentioned, personnel costs are my greatest expense. Commodities we were actually able to reduce, but contractuals went up a certain amount. I think I can sustain that this year, but we'll see where tariffs take us and other budget challenges in the future. But this year we're kind of operating mean and lean, and we'll do well this next budget cycle. Okay, no budget or revenue packages. Not much to report there. And I'll take any questions you might have.
Lean and mean indeed, Dr.
Yes.
Brinker. Appreciate that. Any questions or comments? Pretty straightforward. Dr. Brinker, thank you.
All
so
right.
much.
Well,
Appreciate
thank you all. I appreciate your time.
it. Hello, Laura.
Hello. I guess if you're gonna call him lean and mean, you'll just call me mean because mine's not lean, so. Hey, Laura Forshee, I'm your Director of Emergency Communications. So going into our workforce strength, you'll see that we are coming in again strong this year with our staffing numbers. Our only deficit is in support services. We have a couple of positions that we're still waiting to fill as we are growing into some supervisory roles there. We're waiting really just for our workforce to mature a little bit more before we promote up into these roles. So that's why those positions have been left open within that support services role. Excuse me. Another piece of that is we were granted 2 more positions in this year's budget for our employee development team, and we are going to be moving 2 people into that. But again, we wanted to make sure that we were backfilling into operations first, so we didn't deplete that workforce before we filled into that. So that's where that deficit is there. But we will always have natural attrition within 911. It's not a field that's for everybody, but we are overfilling as much as we can. Growing into where we are in the department, we have another class of 12 that will be starting at the end of this month. And so we're just getting great candidates, and we're so thankful for the supportive commission for that wage increase that is allowing us to do that. So when we look at our services, while fundamental, they're really basic. I mean, we answer 911 calls and we dispatch public safety. And so our mandatory services are our operations and our administration. The administration is mandatory in the oversight of how we spend statutory funds. And so that's why it's listed under mandatory. And then non-mandatory is support services and radio shop. Support services, though, includes that employee development team and assisting those employees as they're coming up through the system and even beyond, and that continuing education and support, which I think while not necessary or mandatory, excuse me, it is definitely necessary. When we look at our strengths, obviously that staffing is a strength and such a difference from where we were, 4 to 5 years ago. And that enhanced support for employee development has been a game changer in our department. We're really enjoying that team and the improvements to that team and the structure around that. We are moving toward that discipline-specific dispatching and that targeted training and development of specialized effective dispatchers. We are working with our public safety partners to develop out that training, doing more field training with them, just different things within that, excuse me, that we're really enjoying. And we're seeing the benefit of it. It's not just enjoyable, it's really operationally beneficial. Some of the weaknesses we're seeing right now is our limited office space, restroom space, locker rooms, and other ancillary spaces as we're building out our staff. We renovated the communications center in 2023. So we have room for this growth that we're experiencing. But one of the things that we run into about every time we hire an academy is, do we have enough lockers? And we're not having enough lockers. Restrooms are a very high traffic area. our kitchen area and having room for fridge space, just the things that you need to support that work environment around this large of a team. We're just quickly outgrowing that space. Recruiting is hindered by limited scheduling flexibility in the high stress nature of the job and demands of shift work. We don't know that we have an answer for that. We're always looking for innovative ways to schedule. One of the things that we are always working toward is having a 10-hour workday. That's what our staff would like, is to do 4 10s, similar to what the Wichita Police Department does. So we are working toward that model. It takes a certain number of staff to be able to do that. So that's part of what we're working toward and a goal that we would like to do. We did that 3 years ago for a temporary period, and they loved it. And I hear about it incessantly all the time. And so that's a goal that we're working towards. And then continuous exposure to high stress situations leading to burnout among dispatchers. So when we look at different projects around the county of how we support mental health of dispatchers, even things within the county of HR benefits for mental health, and how that's supported, impact, things like that. Those are the things that we look at to combat that high stress and how we just try to avoid that burnout. Also, then over time, being able to get people off the floor, more training, things like that to avoid that. Some opportunities that we have, that separation of call taking and dispatching, that improves retention and enhances service delivery. So if you think back to the Brook Hollow report from Jensen Hughes, they really hit hard on that dichotic listing, how we have dispatchers with 2 headsets on. One of those is radio traffic, one of them is call taking. And so you've got a phone call in one ear, radio traffic in the other. It's a lot of input at the same time. And so that is, when you have that level of input all throughout your shift, that's a lot going on, especially if you have a 12-hour shift that you're working. And so not only is it a lot on the dispatcher, but inevitably it's when you have a lot of input, and not always are you giving, you can't give everything your 100% focus. And you've got 2 people in that equation, the caller and your person out in the field, who deserve your 100% focus. So we've been pushing for 10 years now to separate out call taking and dispatching. This is why the commission signed off on the remodel that we did in 2023. So now we have the physical space to separate out those tasks. We just need the bodies to feel that. One of our opportunities also is to support public safety response agencies through new and innovative approaches. When we talk about the Wichita Police Department, for example, is doing their RTIC, which is their real-time information center, which is a really proactive look at law enforcement, and they use a lot of different resources. I don't know if you guys have heard of this. They do it down in Oklahoma City, in Tulsa, all over the country, but you have a law enforcement event that happens, for example, and you start pulling in camera footage and different resources that you have, flock cameras where it's running tags and things like that. And it's just a really innovative way to, without boots on the ground, start solving crimes very quickly and efficiently to have a very good resolution. And so we have opportunities to be involved in that and partner with the city of Wichita. They would like us to partner with them in that. And so we have those opportunities, and we would like to support that, those endeavors as we're invited to the table. And then increasing staff tenure, strengthens institutional knowledge and leadership development. I say this all the time, that I dispatch very differently with 20 years of experience than somebody with 2 years of experience, right? It's very different when you have time and tenure and experience, and you've heard those calls and you've heard that radio traffic. And so we want people to stick around. We want people to have that institutional knowledge. We want them to know the pitfalls and things to avoid, things to listen for, the cadence of radio traffic, what it sounds like when an officer keys up and that stress is in their voice, and how they get ahead of that. So we want people to stay around. Excuse me. Some of the threats that we have coming at us: the rising cost of technology and services, straining budget and resources. I think you're going to hear this. I'm sure you've heard this over and over. In budget, everything is getting more and more expensive. I just yesterday had AT&T on site. We were talking about phone service and things moving to the cloud. And I feel like we're already paying a lot for our phone service. And then they started talking about the cost when it moves to the cloud, and I kind of wanted to throw up. And so these are the things that we're talking about, is that everything's just going to get it's always better and it's always more innovative, but it's always more expensive. And so we're just always planning ahead for that. What's not moving is the 911 tax that we collect, right? And so we would obviously be looking for the Kansas legislature to make some change in that if we were wanting to do that or advocate for that. But that's something that I'm very aware of, is that cost of technology. Public perception issues and lack of understanding of 911 capabilities. There is not constant. I would say there is a lot of misunderstanding about what 911 is able to do and responsible for. And that's part of what we're talking with our community advisory board for. And we're thankful to have that board together to help navigate that conversation. So when we get concerns brought to us or issues brought to us, and it's like, well, this is not something really within our realm of even control. How do we create public education around that so we have a better delineation of what 911 is able to do and not able to do and responsible for and not? And so that's one of the things that we are constantly combating, is certainly not to throw anybody else under the bus or to point fingers, but we want to have ownership in what we can have ownership on, an agency on, and affect change where we have the ability to affect change. And then remaining competitive in the workforce with wage pressures. Obviously, everybody's looking to be the most competitive. And so as we are looking to compete with other employers within Sedgwick County, and they are going to raise their wages, then are we also going to remain competitive? And so what we don't want to do is fall behind like we saw happen, to where we get into another one of those issues where we are not able to draw in these applicant pools that we're getting now to hire these really great classes of applicants. And then the expansion of technology solutions increases the exposure of cybersecurity risks. Every application, every software system, every new piece of hardware, I'm always concerned about cybersecurity. And is that another tunnel, another pathway for somebody to get in? I feel very confident with our IT team that's looking at that. They are very attuned to not just for 911, but network security in general. But there are a lot of stories from 911 directors across the country about being on paper for months as they get taken down by cybersecurity attacks. And the thought is not fun. All right. So when we look at our budget, we are, look at how much money we've saved you this year. We're a little over 12 million. The difference between this year, and last year is we had some grant funding, I think that came off from last year to this year. And then some extra funding for fire station alerting. Decision packages that were on for this year that were coming off. So it looks great that it went down, but it's really not that great. How it breaks out there, again, a lot of it is in personnel. And then we have our contractuals, that equipment, that $1 million was that fire station alerting that went away. Everything else stayed pretty straight across the board. All right, so I do have several decision packages for you. First and foremost is we do want to separate out that call taking and dispatching. That dual role worked 20 years ago. It does not work now. Again, I mentioned that we had AT&T in yesterday, and there was a gentleman from New Jersey that they were showing in, and when we were telling them how we were set up, I mean, his just jaw literally dropped open. The thought of a dispatcher also taking 911 calls. With our current staffing levels, we can start moving in. We want to take a phased approach to this, and we are asking for 20 FTEs for next year to start moving into this separation of call taking and dispatching. And in your packets, Rusty, you said they've got that. Okay. Yeah, you've got a handout in your package. Look at yours. Sorry, I thought I would have them here. That looks at what the staffing need is and where it would be divided out by shift. And so we've got phase 1 and phase 2. When we do the math and we look at how many calls we take, the average duration of how long it takes to process that call, and then how many people it needs to take those calls, and not only take them, but we have worked really hard to get into that 15 or excuse me, 90% of our calls answered within 15 seconds. Because if you can recall, for those that have been around, we were not meeting that consistently a couple years ago. We are meeting that consistently, very, very consistently now, or exceeding that. And we want to maintain that standard. So when we look at that, it says that we need more than 20 more call takers. We need quite a few more. But I think there's some ways to build in some efficiency otherwise. So my suggestion is to take a phased approach to ask for 20 more call takers in 2026, kind of soak that in. And then we would ask for another round in 2027, soak that in and see where we are with it in the numbers in that. So that's what you're looking at on that handout, what those phases look like. And then at the bottom of that is just our call and text growth within the system in that. Thank you. So that's what this is phase one of this. And the second package is some additional phone consoles. I'm going to put a caveat on this, that part of my conversation with AT&T is some different ways to approach this and some different options within phones, especially as we are looking at some different ways. I don't want to get too technical into what the phone options are because it's not going to mean anything to you, but I think that this one may lower, which I know this isn't my highest dollar one. You'd love to see another one lower. But I'm going to say for now, we just have some more consoles that we need to put phones at. This includes some extra phones that we put out there in 2023 when we added on those phone positions that we have been paying for in funds that we have not been using to from our CAD maintenance, because we were not paying CAD maintenance when we first went live with it. And so it's kind of backfilling that funding that we had shifted over there, if that makes sense at all. So anyway, if we have the physical desks, we're asking for the bodies. They also have to have phones to take the calls. So it's the last piece of that package. All right, our third decision package is a tracking system. In that Jensen Hughes report, one of the things they recommended, which I really think is a very great recommendation, is to have a tracking system where we serve 31 agencies. And so for those agency partners to be able to say, hey, we had this issue come up, whether it's a radio system issue, a CAD issue, an operational issue, something where they have a consistent process around reporting the issue, and they can submit that ticket, and then they can see it, we can see it, we have a way to track it, log it, and report back on what's happened with it. They can view it, we can view it, and so we have transparency around where it ended up. It's not, kept within just one person. I will have, for example, I have a new chief that took over in a community, and he's playing catch up, trying to figure out where some issues are. If he were able to go in, for example, and see this dashboard of issues within their community even and where they are, he would have just a leg up on that. So that would be just one example of how this could be used, but just better tracking and accountability with that. And so that's what this software system is. There is a $20,000 ballpark price tag on this, and then there's some continuing funding for that as you implement this and then go through support beyond that. Just to say, we did check with our county IT on how we could do this in-house. The issue we have is that because there are external users, we can't have an in-house solution where they would have access also. They could submit something, but they wouldn't be able to view it. And that was a piece of that, to have that full transparency in that. All right. Our fourth decision package is an accreditation manager. This is going to be the second year you guys have seen this in our budget package. We want a professional entity to come in and assess our system, provide recommendation, direction, give it the rubber seal of approval. We want to continue to grow. We want to thrive. We want to do well. And so having an accreditation agency to help us push for that excellence is what we're looking for. Because we serve a multidisciplinary system, we don't want to accredit through just one body. So there is a law enforcement accreditation body through CALEA. We can accredit or do accreditation, we'll say, through the International Academy of Emergency Dispatch for medical call taking and then also for fire call taking. So we don't want any one discipline to think that we're overlooking them. But if you go for all that, you need somebody to manage it all. So that's what an accreditation manager would do, is not only manage that accreditation process, but then training and policy development outside of that or to support that. And then we have our public education and recruitment efforts. Again, working with our community advisory board, we've been talking a lot about how do we get our messaging out to the public and make sure that it helps to answer the questions and concerns that we are looking at. And that was also part of the Jensen Hughes report, is to have better public relations and to tell that story. So there are two pieces of this. One is a software system that sends out text to actual 911 callers. And you're judicious on how you do that. So you don't want to send it to every 911 caller. Obviously, if you have a horrible, tragic event, you don't want to text right afterwards, like, how did we do? Wichita PD does this now through Axon on some of their calls. So it'd be a similar system to that. But that's not anecdotal evidence. I mean, that's not people on Facebook, that may not have called even our system saying, well, 911 this. And so we want to be able to gather that feedback, and then we use that feedback to either provide system improvement, feedback to our staff, or we see gaps of education where, hey, this is what the expectation was from our community member. This is what our opportunities are for either meeting that expectation or educating to what is the reality of what's going on with 911. And so it's the software and then also that funding to develop the educational materials out of that. So we are looking at, this is just the first part of our decision packages. Then you add on the rest of it. So a little over $2 million. We have no revenue. Sorry. Do you have any questions?
Okay. Thank you, Laura. Appreciate it. Any questions or comments?
Question. Please. Hi, Laura. Thank you. What is your feeling that the state would move the fees on the 911 fees on the billings?
Not promising. They just
We tried
did,
this a couple years ago.
they did move it slightly a couple years ago. And the initial proposal was to move it higher than where it ended up. Right now, what we're waiting on is that the Kansas Coordinating Council just got moved from a standalone agency to a state agency. And part of that discussion was that they have a large funding pool that needs to be distributed. They've just been hanging on to this money. And so the legislators weren't eager to raise the tax fund when they're holding on to this big pool of money, which makes complete sense. And so they are looking at expanding some grant opportunities. They've even talked about pushing some of the monies back out to the counties because they have this very large pool of money there. And so I'm waiting to see what happens with that, which I'm hoping that they come up with a plan very quickly, because now that they're a state agency. And then I think the discussion begins on what does that look like funding wise on where everybody's sitting.
Okay,
That's
well,
And Commissioner, can I add something to that? We
Sure.
can't use those funds on personnel.
no.
That doesn't, I mean, it helps with the increase in the phone lines and some of those things, but it doesn't necessarily, the personnel component of Laura's budget is funded entirely with general fund.
Thank you, Lindsay. You're
Good
right.
to know.
No, you're absolutely right. Yeah. But when we talk about, software, technology, things like that, we can use it for that stuff if it's directly supporting the delivery of 911 services.
well, I think we can make a mental note or whatever that seems like we've had such success in our legislative agenda by narrowing our 10 lists down to 2 or 3. And I don't know if this would qualify that as we get into next year or the end of this year. That's
We should move on.
Thank you, Chairman. I appreciate you putting together the funding for addressing the Jensen Hughes issues. Do you think you're asking for adequate funding to address everything that was pulled out by or recommended by Jensen Hughes?
Yes, I think, yes. in the sense of, I think we need to start with this and then allow it to soak in and see where we are. The people are my one thing of like, if we ask for everything up front, because I believe it's around 48 people, I think that we need to completely separate out call taking and dispatching. But I'm very weary of that number, and I would hate to have all those funds added in to do that and have that be too much. I don't think that that's a fiscally responsible way to approach that. And so I would say yes, with the caveat of don't be surprised if you don't see me back asking for another request.
So you're maybe piloting some of this to see how it works.
Piloting, yes, or approaching it in phases to ensure that we're making the steps in the right direction. Yes.
Okay.
But otherwise, I mean, so that's the separating out the call taking and dispatching. The rest of the recommendations, a lot of them were process improvements or policy updates, and most of those have been completed. Relationship building, that is actually going very, very well. Then yes, the other things, the software system, we're doing really well on that list, and it's been very positive.
I appreciate it.
Yes.
Thank you.
Okay. Sure. Thank you, Chairman. On the $2 million worth of requests here, how much of that's covered through 911 tax versus property tax?
Well, the personnel is 100% property tax. On the rest of that, the personnel and the public education also, and the tracking system, those cannot be out of 911 tax funds. The
Consoles?
phone system could be. The accreditation manager would be no. So the phone consoles could be covered under 911 tax funds.
You talk about some of the building deficiencies that maybe cause some challenges for the folks there. Is there still a plan at some point to move the public safety building to the northwest, and we're going to have the emergency communications take over the entire facility on Main Street?
Yes, you're going to see in your CIP presentation tomorrow, a recommendation that we fund the Emergency Preparedness Center, which would then move all of emergency management out of the public safety building and into that center. Excuse me. And then that would allow Allure to take over that entire building. And I think the idea is the call center itself would remain on the second floor. Everything else would move down to the first floor.
So those things listed here, I think will be probably pretty addressed. And if that goes forward, these are being addressed.
Mhm.
Couple more quick questions here. Your folks that sit at the consoles, is that console like assigned to that person and they're the only ones that sits there, or are these consoles used by different people on different shifts?
Used by different people on different shifts.
Very good. Are you utilizing are you using LETC for anything more than just training, or is it only for training?
It's our backup site also. So, for example, when we did our remodel, we operated out of there full time. If you can recall back to budget presentations 2 years ago, you guys funded us to do full radio backup consoles out of that to improve that functionality. And so it's fully functional, hot, ready to go. And we're actually going to flex into that for another operational shift here in the next couple weeks, just to test it, make sure we like to test it and operate it every once in a while, just to make sure everything's good to go and our staff is familiar with it. So that is our primary purpose of it, is always as a backup site, and then also as our training academy.
I guess what I'm saying is it's not used routinely necessarily for day to day. It's primarily the backup and for training.
Yes, no, not day to day. No. Mm-mm.
Couple of quick ones here. The tracking system, I don't quite understand what that is going to do. What exactly does that do?
So if you were to, say you're in an office or out in the field and you're trying to do something in CAD and it's not working correctly on our computer aided dispatch system. So right now they, who do I contact for this? And they kind of go through this route of, well, let me call my IT, and sometimes people get shuffled around. So you could go to this website. It would be a web-based system. You would be able to enter in a ticket, and it would create a ticket number. You describe what your issue is. That ticket then comes through to 911. Well, then we can direct it over. Is it going to go to an application manager within IT? If it were a radio issue, I'm going to send it over to Radio Shop. If it's an operational issue, I'm going to send it to my operations deputy director to look into. And so now that is tracked with that ticket number. We can make notes into how it evolves and how was it resolved? What was the finding on it? And then the director, the chief, the whoever from that department is able to go in and see what tickets were submitted by my officers, firefighters, medics, how were they resolved? Were they looked into? So we get these stories that we reported all these issues of CAD not working, or, our radios never work. We have all these coverage issues. Well, we're sometimes in the boat of saying, well, we've never gotten these reports. We've never received this. And they're saying, well, yeah, you did. You didn't do anything about it. And it becomes this battle of he said, she said, and that's what we would like to eliminate.
I guess using IT people, and when you call in a problem, you get issued a ticket number immediately and it gives you the narrative. So I guess I don't understand. We have a system in place right now to track technology challenges. And I'm wondering why we need another one when this is already basically happening.
Commissioner Joe Courier with IT. Our current system that we utilize for workflow within IT to track a situation like she's talking about is not external facing. It's actually reached its end of life, and we're looking to replace that system and move forward with that. I don't know the dates, timelines on that. That's all under another department that I'm not responsible for, but we are looking into it.
Okay, so as that conversation develops, maybe we should be looking at one thing that can handle both
Absolutely.
that problem and maybe an update to what you're doing there. I just don't know if and it's also interesting to me that Jensen Hughes, which I think was supposed to look for what went right, what went wrong during the Brook Hollow fire, that they're getting involved in something that's, I think, is completely outside that case. Again, I've read that report. Apparently I didn't remember this item. So it's just odd to me that they're making recommendations for improvements that really have nothing to do with that case.
Well, yes, the only application with that case was that there were 2 fire crews, I believe, that said that they went to go get in their vehicles and their MCTs were not working. It wasn't an issue with CAD. It was that their computer had updated and their MCTs weren't on. But I think that's how there were some additional considerations. If you think about that report, there was the Brook Hollow specific report, and then there were some additional considerations for the system, for 911, for Wichita Fire, and that was part of that additional considerations as they delved beyond the Brook Hollow incident specifically.
2 more really quick ones here. How many 911 emergency communication departments across our country that are our size are accredited? We have any idea how common is that?
I don't know how many specifically. I know that it is not unusual, especially at our size, very much typical to be accredited, but I can get you specific numbers.
I guess what I'm saying is if it costs money to get accredited, but is there any opportunities like applying for a grant, or is there something that the accreditation provides to us other than just an assurance that we're good?
So on the accreditation for the medical protocols, I know, for example, if you wanted to do the nurse triage line, which we've talked about doing before, so that these low acuity EMS calls, instead of going out for EMS, they could be shunted off to this nurse triage line. You have to be an accredited agency to be able to utilize that through International Academy of Emergency Dispatch. So that's been one thing that EMS has wanted to pursue in the past that we've been unable to because we are not an accredited agency. Beyond that, I do not know of any opportunities that we are not eligible for because we're not accredited. No.
I guess my takeaway is, a lot of our public safety agencies like to have accreditation, but it sometimes costs money, and it affirms, if you will, that we're good, but it doesn't necessarily provide any actual benefit necessarily. So with that, I want to be careful with tax dollars. I don't know if we know we're good, then it's great, but I'm not sure we need to spend money necessarily to, I guess, impress someone. I don't know.
We used to be accredited through the IEED for medical protocols. And I will say that I was the one that shut that down years ago because it wasn't anything that pushed us to be better. And I felt like it was a waste of time because it did not push us to be better. I go back and forth. My understanding is it's gotten much better. The CLIA accreditation, I know will push you to be a better agency. I will say just really honestly, I did not like when all this happened and my team was under fire for things that I did not find to be accurate, that the only stamp of approval for how great our team was my own. I want something better.
Good answer. A couple quick ones. Are we going to see anything in 911, in the CIP for 911 this year?
No, and I mean, that emergency preparedness center.
I just didn't
slow
know.
down effect 911, but it's not even necessarily going to be funded.
Okay.
Through 911.
I'm loudly publicly supportive of the model change with call takers separating from dispatchers and discipline specific dispatchers. So I'm going to support that. I think you already know that. I think everybody else already knows that too. My question is, we're going to look at this over two phases.
Mhm.
Phase one, 120 up to, so plus 20 FTEs. Phase two is plus 18 FTEs. Is there anything else do you envision any other decision packages coming for phase two? I know that it's probably not fair to ask that question yet. I'm getting at, is it possible to push back some of the other decision packages like the accreditation or like the tracking system or like the public education into the phase two so we can kind of spread this out a little bit more or maybe separate that? I mean, we have 5 decision packages. I'm just curious, and we're going to do this over 2 phases. So there'll be a decision packet next year for 18 FTEs likely.
Right.
So I'm just curious if we can spread it out over 2 years or if it needs to be all this first phase one.
So to be clear, the phase one and phase two are simply on that staffing for that. The other decision packages outside of the phone consoles are not part of any phased approach. And so how you split those up as commissioners is absolutely your will and your decision on what you think the priorities of the county are. We will make do with whatever you prioritize for
But
us.
your answer to the accreditation manager really changed my perspective. And I see that as an emphasis. I'm just trying to find a way to get this done over 2 years in a way that accomplishes what you need
Mhm.
and accomplishes what the community needs while also maintaining some
Yes.
stewardship over what's going to be a tight budget, because I'm looking ahead at some of the decision packages that are coming, and I know there's some incredible needs that are coming. So
The tracking system, if I were to say one that could be pushed, and that's such a low dollar one, but
Yeah, I get it.
every dollar counts. We have a new CIO, and I have no doubt that if we don't do that one now, I'm going to go to him and say, let's come up with
Sure.
some really innovative way to do this, even if it's not something that outside people have opportunity to look at. Like, I don't know. I just think,
and you don't, and listen,
Yeah.
and
I'm just
honestly,
thinking through, what we could do. That would be one.
and you don't have to have an
Yeah.
answer today. My point
Yes,
is,
I can look at that.
from my seat, I see 2 phases that I'm going to be supportive of
Yes.
because I see the need. And if I'm the one pushing and asking and pleading and prodding and you confirming, model change is what we're going to do, then I need to support the model change.
Yeah.
But I want to make sure that I want to just phase one and phase two. I'm just trying to look ahead and look out. Unless I get recalled, I'm going to have some decisions next year on this thing too. So there's a good chance based on today I may, but I'm kidding. But I just want to see if we can spread this out anyway.
Absolutely. Really, I mean, we want to make sure that we push really hard on that separation of call taking and dispatching. If I could
I agree.
fervently advocate for that, I would. And then I just want to remain really responsive because we owe it out of that
Agreed.
Jensen Hughes report to do so. And that's,
And I believe in the
We're looking at-
accreditation manager piece too. I really do. Tom, any
So-
thoughts?
Just a couple technical questions, quick, Laura. So I've heard you say 148 as a number. The calculations within phase 1 and 2, you're doing 138. So that's a minimum based on, as Commissioner Blueball brought up, kind of a prototype going forward.
yes. So that what I have in phase 1 and phase 2 is what we can put into our comm center with the room that we have now in doing that. And I think that will get us to where we want to go.
So as you bring these additional people on, just from a technical perspective, how does that work? Then you increase, you don't flip a switch one day and be call taker to dispatcher. That's transitional.
Mhm.
So as you get these people on, more call takers, then you've got a number, some of your shift, 60%, 50% of your shift, you've got separation there, but as you increase bodies, someday that would be 100%. Is that the accurate way to look at that?
100% dispatchers, is that what you're saying? Yes. So the goal is that you would have all your staff and they're all funded to dispatcher levels. So I'm going to come in this desired model, and perhaps the first part of my shift I dispatch, and then the second part I call take.
Okay.
And the reason is that as you have that dispatch experience, you become a stronger call taker. Not only do you have more tenure, but you know what the firefighters are going to ask, officers are going to ask. And so
That's helpful
just-
clarity. I
yeah.
appreciate that. Okay.
Yep.
All right. Any other questions? Hey, Laura, thank you
keep it
so much.
straight.
Appreciate it.
Yeah.
Hey, the public service exceptional employee.
Yes. Get me all red faced up here already. Good afternoon, Julie Stimson, Sedgwick County Emergency Management Director. I've got very few slides and very little asks, but I do have some challenges I do want to communicate to you guys forthcoming. Similar to Laura, I appreciate the compensation packages, and I am fully staffed at 100%. Hopefully we stay that way for quite some time. A lot of mandatory services, but the mandatory services are very vague. Pretty much everything from disaster preparedness, response, and recovery is mandated by statute. Public education, training exercises, the local hazard warning and notification systems, those are all required by Kansas state statute. How we go about doing those and what components make that up, we've got a little bit of flexibility. Non-mandatory is our volunteer programs. There's nothing in statute that says we need to have active volunteers. But for us, we know that is our force multiplier, and that is our community engagement, and that is our community resiliency. So we certainly put a lot of emphasis on volunteers, regardless of state mandates. Strengths, like I mentioned, we are 100% staffed. We want to keep it that way. So far, things seem to be going fairly smooth. Volunteer teams continue to grow each year, which is, again, mentioned force multiplier for preparedness, response, and recovery. And we've seen a lot of strengths with solidified relationships with elected officials, senior management, schools. Our request for presentations, training, and exercises has gone up 80% in the last 18 months. My team's been very busy going out, talking to a lot of folks, educating people of especially preparedness. What are the things that are still a risk to us, and how do we prepare for those disruptions? Weaknesses, it's a strength to have volunteers, but it's also a weakness because right now we have more than 200 volunteers just with our community emergency response team. We also have a K-9 search team, and we have amateur radio. So we've got about 250 to 275 volunteers. And to keep them actively engaged, I'm grateful we don't have a lot of disasters to respond to, but we want to keep our volunteer pool trained and ready to go. That's quite the administrative burden to track hours, to track training, and all of that. So my Department of 5 is starting to feel a little bit of a stretch with time and resources. And our increased community outreach activities on top of that has also strained a little bit of my staff. So in the years to come, we're probably going to be looking for another staff member to help us with some of these administrative things and community outreach requests. Challenge reaching the whole community, especially vulnerable populations and non-English speaking and access and functional needs. We are working with that. We're starting to develop some partnerships with agencies to help us with that. And then also one of our weaknesses is we have still a lot of response equipment stored in multiple locations, PPE stored in a non-temperature controlled warehouse, which will lead into our opportunity. We mentioned the Emergency Preparedness Center, and kind of have that on here for opportunities. Which is on the bottom. I'll just transition into that. So the Emergency Preparedness Center, CIP, is an opportunity to resolve our disaster response and PPE challenges, allowing emergency communications to move into that whole public safety building, and also provides a fixed facility for the health department during their incidences. So it's 3 departments that really will have some benefit to that Emergency Preparedness Center. Back on top for opportunities, continued approval for that 6-year CIP. We're right in the middle of that right now for our outdoor warning system. Department will eventually save about $65,000 in annual electrical charges and reactive maintenance cost. And also at the same time, the same CIP will increase our coverage from 92 to 98%. So we're right in the middle of that 6-year project. We definitely want that to continue. And the records and the statistics are proving us to be cost savings by going to this different model. And then continue to expand volunteer programs for community resilience, response, and recovery as a force multiplier. We do have some threats. The Emergency Management Performance Grant was already decreased by 10%, and that funds 2 of my positions now. So we are definitely keeping a close eye on what happens with that grant. We already know some hazard mitigation grants, such as that BRIC grant that we were just really starting to kind of learn more about, went away. That is a big concern for me, that if we lose our mitigation grants, our response and recoveries are going to get a lot more expensive. So we're definitely trying to keep pulse on that and try to create ways of how do we still reduce our impacts for the disasters. And then, as we know, nationally, FEMA's under a lot of audits and scrutiny of what can federal government, what shouldn't be supported. The focus right now is the disaster response and recovery at the local and state level, but with little to no federal support with current fiscal resources. So this is, again, something we're keeping a really close eye on. Again, kind of reiterating, things have always been at the local level, and that's the way it should be. Our tornado in 2022, we didn't qualify for any federal assistance, and we still did have a successful recovery, got folks back into their new normals. But my concern is if we were to have a tornado like we did in 2022 go right through Metro Wichita, there is no way local resources are going to be able to help us recover from that. And I don't know how confident I am that the state would be able to provide us those resources. So again, really keeping an eye on the pulse of what's going on with our disaster response, relief, and our hazard mitigation grants and programs moving forward. Looking at the general fund, I don't have any requests. I don't have any decision packages. So it's just pretty much maintaining. I know the numbers look fantastic. It looks like I'm coming in, reducing our average request by 42.5%. But our CRPs, yeah, I'm the hero, right? The Public Service Award winner. That's why.
Yeah.
Maybe I'm underselling my stuff. I should be asking for more.
What is that general fund decrease?
It's the fact that we don't have the siren replacement in yet because we don't have any CIP built into the
Okay.
budget.
Yeah, the CIP
Okay.
is 656.
Back.
Yeah.
Okay.
Yeah. So
That-
these
that
numbers are
helps.
definitely going to change. Yeah. Yeah. I'm like, it looks amazing. We definitely do not want to cut our budget by 42.5%. Please do not do that to me. And this is just kind of a breakdown. Our biggest cost, we do have, of course, our personnel. We do have some contractuals and commodities, and a lot of it is to maintain the outdoor warning system, but it's much cheaper now to already maintain it than it has been in years past. We're pretty much replacing batteries instead of replacing electrical motherboards and speakers and all of that electronic stuff. So we're already seeing a good improvement with that. And then our equipment isn't breaking down as much already. So we're happy with that. And then the interfund transfers, like Lindsay kind of mentioned, CIP, those funds aren't showing up in here yet. So. Like I mentioned, no decision packages or alternative reduction revenue packages. We don't have any revenue. And that is it. Short and simple. Yes.
Simple, yes. Okay, questions?
When you're saying that your maintenance on the new maintenance, is that under, do you have maintenance people or is that under Lynn's group?
We actually contracted out with a outdoor warning system contractor.
Business that does that.
Yeah, there's actually several. Yeah. Yep.
Okay,
All
other
right.
questions?
Again, appreciate your support and
See you at 5 o'clock.
yes, sir.
Hey, team.
Hello, good afternoon. Brian Nicholas, EMS Deputy Chief. Chief Lannerman regrets not being here. He had an obligation out of town. So,
Okay, good.
first of all, I just wanted to say thank you for the comments that were made today in the BOCC meeting regarding our 50th anniversary and the proclamation. I mean, that's very meaningful. Very appreciative. I'm starting off with our workforce. We've seen steady progress. We're happy with the progress. Currently, we're staffed at 91.3% overall. And specifically focusing on operations, we've improved from 89 the previous year and 87 the year before that. So We're not where we want to be, but we are improving. You'll see we've got some other positions over in operations that are not filled. We've deliberately delayed filling of that just so we didn't pull too much from the field personnel, but we're planning on getting those filled. And similarly in logistics, we're down 3 positions, but those are open. We're going to have those filled within a month. So overall, our staffing is improving. We're happy about that and very appreciative of the focus that's been made on compensation over the last few years. That's definitely assisted us. We truly don't have the mix of people that we're wanting though, because we've actually got 31 open paramedic positions, but we're supplementing that with 17 EMT underfill positions and also 6 in our education program. We call our E2P EMT to paramedic program. So the net of that is down 8 positions. So overall personnel is better, but we've still got more work to do on that front. Surprisingly, EMS is not mandatory. We wish it was, but it's not an essential service in the eyes of the legislature. But we have lots of non-mandatory services that we provide over there, and this kind of leads into our SWOT analysis. As far as strengths, like I mentioned, we are near full staffing. We don't have the mix of staffing we want just yet, but that has been, again, due to your focus on compensation. We think our education program has been beneficial. We've also really ramped up our efforts as far as recruiting. You can see there, increasing visibility in the community. We did over 101 PR events last year, including 11 CPR events. One of our strengths is our education program. We provided over 60 hours of education to our providers. So there's been a lot of good things happening along those lines. As far as our opportunities, this leads into some of our decision packages regarding mobile integrated health, exploring those options. We would like to explore optimizing our inventory management system. We have a lot of commodities that are perishable, and we are wanting to find a better program as far as managing them efficiently, and we want to work with our partners in IT and purchasing to see what we can do there, because we think there's a lot of more efficient ways of doing it. Provider safety, again, that leads into one of our decision packages as far as body worn cameras, opportunities for employee wellness, credit to our relationship with the Sheriff's Department. He has offered the employees of EMS the opportunity to utilize their wellness coordinator, which is just a great resource for us, as well as the other county resources like Impact and Cortico app. As far as weaknesses, it shouldn't be a surprise to anybody, our increasing call demand. Last year was an exceptional year where it went up 5%, about 3,500. Normally it goes up about 3%, and which not surprisingly leads to issues with retention. The E2P program addresses that to an extent that we'll talk about that more. The ongoing shortage of unaffiliated paramedic students. There's just an overall shortage of paramedic students, and we've worked hard to increase our efforts to recruit those. We have somebody that goes to every single EMT and paramedic class in the region to do recruiting. We hosted 191 EMT students last year, and we hosted 25 paramedic students. So there's definitely been a larger focus on getting the word out to all of these groups as far as the benefits of EMS. Threats. Not surprisingly, about 63% of our user fee revenue is Medicare, Medicaid. So, we're always susceptible to any changes in those programs. Although in recent years, it's actually been beneficial to us. Like I mentioned before, with our commodities, we have a lot of perishable commodities. We're concerned about the tariffs. A lot of our pharmaceuticals come from overseas. And so we're hoping that doesn't have a large impact, but that's definitely a threat to our organization. And again, just as far as our response to disasters, mass casualty, I mean, again, staffing improvements help all of that. And we have a wonderful group of people here that step up when needed. You know, when there's an ice storm or when there's a large scale event, we have a lot of folks that step up and do the job when it's necessary. But we want to improve our overall day-to-day operational staffing. So it doesn't have to, so people don't have to step up as much, but we have a dedicated disaster medical support team and other teams that really do a great job. Another threat that one we want to address today with our body worn camera decision package is increasing incidents of violence towards EMS providers. And it's kind of a sad commentary on our society, I guess, but unfortunately that threat is still there. So we'll talk more about that. Moving forward, let me go to the next slide. As far as the breakdown, overall, our budget is less. And it's almost exclusively personnel. 1.8 million of that is personnel. Or excuse me, 1.6 of the 1.8 reduction is personnel. And that's largely because we liquidated some unused part-time positions to try to free up budget authority for these other projects, other FTEs. So that's essentially why it went down, is we had quite a large number, 17 actually, of excess part-time positions that we weren't able to fill. So we thought by removing those, it would definitely help the overall budget and give more flexibility for some of the other more needed requests. We did have a few adjustments there in contractuals and commodities. Roughly contractuals went up about 144,000, commodities down 145,000. So that was largely budget neutral. I will say we've been working with finance that we may need some additional adjustments here before the end of the year and going in next year, but we're still trying to tie down the exact numbers on that, but a lot of fluctuations along those lines. So decision package, I have to warn you, we have about 8 of them, but I'll try to go fast and then of course stand for any questions. This is one of the things, our first one, our EMT to paramedic education program. I think this is one of the most beneficial programs we've ever developed here. And just for background, you know, historically in EMS, you had to get all your training up front, all of your to where you were a paramedic, and then we hired you as a paramedic. That's in contrast to law enforcement or fire, where they hire you and then train you while you're an employee. So this program actually allows us to hire EMTs and then support them as full-time employees as they go through to get their paramedic education. And by doing that, they sign a 5-year work agreement. And so this has been very good for our retention. And the other good thing is it allows us to hire EMTs, kind of vet their performance to try to determine the best candidates that are actually going to succeed in the paramedic program and then support them on through. And so it's been very successful. We started in 2022. We've actually had 21 people complete the program. And excuse me, currently we have 6 enrolled. And the decision package in front of you is to try to expand that from 6 to 10. In other words, just add 4 more positions to this program. And this will correlate with the next decision package that we have, which is regarding 6 full-time EMT positions. As I mentioned earlier, we have 17 EMT underfilled positions, right? But we actually only have 4 EMTs on the staffing table. So in other words, if we could add 6 more, that would give us 10. And with the idea that 10 is the amount that we can maintain long-term with these 10 EMT positions feeding our 10 education program positions, we think that that will allow a good model moving forward. And by moving those EMTs into actual EMT positions, that would free up 6 paramedic positions to be filled by paramedics. So that's a stepwise approach. You know, obviously we will eventually need more paramedic positions, but we think this is a reasonable move to make currently, giving the number of potential applicants that are out there today. So. All right. Okay, moving on. Our next decision package is 2 FTEs for a paramedic mobile integrated health. Mobile integrated health is kind of a generic term that's used around the country as far as, and it's defined that way as a generic term because you have to mold it to each different organization. And so we think there's an opportunity here to really help with this non-traditional response, you know, as opposed to just picking somebody up with an ambulance, taking them to a hospital, and to try to align the correct services, correct resources with the individual. One of the reasons that we're discussing this is in 2024, we had 278 patients that were transported 10 or more times by ambulance. And within that group, 70 patients were transported 20 or more times. And so I think it's a safe assumption that these folks probably didn't need 20 ambulance transports and 20 visits to the emergency room. They clearly need access to primary care to manage their chronic illnesses. And so it ties up many of our resources, our advanced life support, ambulances, and other resources to manage these folks. So the idea is this position can meet, you know, they would be in a separate SUV. They would drive to the scene. They would talk with these people, figure out what their true medical needs are, align them with those services that are available to try to reduce the recalling of 911. We really think this will be beneficial to our high utilizers of the system. And as you can see there at the bottom, another option, you know, we currently have our ICT-1 teams, and they focus generally on mental health. Another option is if we could free up that FTE that's currently servicing the ICT-1 teams to allow them to fill this role to where they would be responding to not just mental health patients, but also all of these patients that have various needs, but they could still respond to help the ICT-1 teams when necessary. We're finding that having a paramedic on the ICT-1 teams all the time is probably not the most efficient model. So we think this would be a more efficient way to use these FTEs. So again, the request is for 2 FTEs. We could drop it to 1 if we had maybe some flexibility with the existing FTE that we're using for ICT-1. All right, next. Our controlled medication management system. This focuses on the controlled medications that we have that are regulated by the DEA, Kansas Board of Pharmacy. I'm talking about pain meds, sedation meds, you know, fentanyl, ketamine, midazolam. All of the controlled medications are the medications that could be abused. We would like to implement a better system to track it. The technology has improved to the point where there are systems with RFID tracking of each med, where we can track it to each individual who accesses the med and how it's used, when it's used. If there's any, you know, we're dealing with an opioid crisis right now, and there's a threat out there of theft or diversion. And this helps protect employees. It helps protect our patients and just the citizens by increase the better technology that exists today that will allow us to track this very comprehensively. Currently, we're just using a lock and key system with no individual tracking, and it's okay. I mean, we haven't had any issues of lost medication, diverted in medications, anything that, required to be reported, but the risk is there. And so we're just trying to move forward with the technology that will help us really control these medications. Every ambulance has them. And so we want to have a very secure system to protect them. 3,000, about 270 patients a month get these controlled meds. So, I mean, we use a lot of them, and tracking, it's very important. Okay, moving forward, we're requesting an ambulance. One additional ambulance to expand our fleet. And this goes along with our efforts to just keep up with the annual growth. I believe you have a chart in front of you that shows our estimated ambulances that we would like to have on the streets every year through 2029. Essentially, we would like to add two 12-hour trucks every year. And we think if we keep doing that, assuming about a 3% growth in call volume, by 2028, we believe we'll be where we want to be as far as staffing levels and our unit hour utilization. We think that'll get that down to about 0.4, which is at a level where there's a significant reduction in burnout, fatigue, and definitely increase our services to the community the way we would like, to where I know Commissioner Howe has mentioned status events, and we have about 2 per day. And so we just want to continue reducing that. So as you can see, this graph simply shows a 3% increase in volume every year, and assuming a 3% increase in max call volume. And then if we add an ambulance, roughly the equivalent of 1 24 ambulance every year, or 2 12 hours. I say 2 12 hours as opposed to just 1 24 because we like the opportunity to align the shift with the demand. It might be 6 to 6, it might be noon to midnight, 3 to 3, however. So we try to refer to the ambulances in 12-hour blocks rather than 24. So, excuse me. If approved, this ambulance would get us to a fleet level of 34, and it would give us 9 spares. And I mean, 9 may seem like a lot, but we don't really consider it a lot because you have to keep in mind, for example, right now we have 2 ambulances out for repairs. We're behind in our remount program because of all of the supply chain issues and everything that occurred during COVID. We usually would remount 3 or 4 a year. We currently have 5 scheduled for this year and 8 scheduled for next year. So if you take that out of our spare status, it drops quite quickly. So to assist with that, there's also going to be a request coming to retain a couple ambulances in our service that would normally be removed just because of high mileage. But we don't want to cut our spare status too close. It's a balancing act. We want to get these ambulances in for remount, but we don't want to cut ourselves too close. So we think that this request will allow us to sustain where we need to be. And I'll say that with the idea that we're probably going to be requesting an ambulance about every year just to keep up with call demand. So fleet expansion. So in addition to just the normal replacement, which that's going to be about 7 or 8 ambulances per year just to replace what we have. And in addition to that, probably 1 fleet expansion ambulance moving forward. Almost done here. This is a request for an SUB. This correlates with our MIH program, the Mobile Integrated Health Program. If we get that FTE, this will allow them to drive to these patients and manage these patients. And one point I forgot to add in the previous discussion was the goal of this position is not to manage these patients' healthcare long-term. It is to manage them short-term, get them aligned with the resources they need and move on, maybe a 30-day period at the most. And so we're not trying to compete with home health or any of those other agencies that provide those services. So again, this is just to support that, have a vehicle for that position to use. All right, the next one, number 7, our body worn camera system. We are currently participating in a trial with the Axon body worn camera system. It's a 3-month trial that we've used on 3 ambulances and 1 supervisor, 1 field supervisor, one of our district chiefs. And we think that this is a positive step forward. It's becoming more of the standard in the industry. We think it reduces legal liability, increases transparency. It's beneficial for quality assurance, employee safety. We pulled some numbers back through 2018, and we had 212 incidents of violence against employees that was actually reported, or roughly 30 every year. And like I say, that's what's reported. There might be other incidents, but these are incidents where somebody was in danger. They felt like they were in danger. They pushed their emergency button. Every law enforcement agent in the vicinity comes, lights and sirens to protect them. And, the threats are just out there. I mean, we just had a horrible incident in Kansas City recently where a responder was shot where a responder was stabbed. But we do fully understand this is a big amount. And in addition to this initial startup cost, it's about $243,000 per year ongoing cost. And that's largely due to data storage fees, because it's a lot of data, and we have to maintain it very carefully to comply with all guidelines of HIPAA for protected health information. And so managing that information is a lot, and we understand that, but we think that this is going to be beneficial. So we request you consider it. And then finally, we have a request to support our training department with some mannequins. These are they're specific mannequins to support our critical care program, mannequins for airway, more invasive procedures. And it's designed to train a large group, because that's what we've got 200 plus providers, and it's a big effort to get all of them trained with hands-on training. So this will help support their classes as far as teaching a large group of people these skills. And so in the packet, there's a specific breakdown of the various mannequins, but we would request your support with that. I would say our training department is something that I'd like to brag about. They've been doing a really good job. You've heard in the past where we've implemented a critical care level of training, which is absolutely true. But we've actually, the gap between the normal paramedic and the critical care is really, it's really grown smaller because we've elevated the level of training for everybody out there. And so there's just a few invasive procedures now that not everybody can do. And so this has just really been beneficial for the entire community. It's hard to quantify it, but I can tell you it really has been beneficial. So just to summarize here, you can only put 3 on a slide, so our total is 2.1 million. And I would just comment that our department is unique from other departments in that we're largely self-funded. The burden on the taxpayer is fairly low. There's been a lot of people working very hard to have a solid revenue stream. And so I think our department, the EMS department, does a lot of good work to, as we say, get clean claims out the door. We have a billing vendor that is doing a really good job. Credit to our CFO and the work, and they've devoted resources to billing our, getting claims sent to the Kansas Set-Off program and things like that. And so it's really been beneficial. So altogether, I mean, revenues have been increasing, and, the tax supported portion for EMS has actually been decreasing over the last 3 years. In 2022, it was about 21%. This last year, it was about 13%. And that actually includes about 1.8 million for the new post 1. So the burden to the taxpayer we're showing is about 2.8 million is all there is. So, and, we're hopefully going to continue to benefit from, our revenue has been strong. If you recall, in January of 2025, you increase user fees. We think that'll generate another 1.1 million. One of the biggest benefits for us back in 2023 is when Kansas Medicaid rates increased to rural Medicare rates, and that was that increased our revenue by roughly 1.5 million. So a lot of good things. So with that, I have Deputy Chief Angela Fuller here as well and we'll stand for any questions.
Okay, very good. We'll have a couple questions before we get going. Lindsay, has risk management had a chance to review that controlled medication system and the body worn system? Have they had a chance to weigh in on that? Is that something they would normally weigh in for us so we have an idea of?
I don't know that we typically would, but I think it's a great idea to do that.
Well, I just want to make sure, I mean, particularly on the medication piece there,
Yes.
the liability piece, I think risk management should probably take a peek and inform us of where we're at. Okay.
Mhm.
Okay, questions? Commissioner Howe.
Just a couple quick questions here. You talk about the mix of employees. Can you please explain what do you mean by that?
Well, what I mean is we would like to have all our paramedic positions filled with paramedics as opposed to underfilling EMTs, but there just hasn't been enough paramedics available despite all our recruiting efforts. So to keep the truck staffed, ideally we'd like to have 2 paramedics on a truck, but we just don't have enough. So we're supplementing by staffing several ambulances with paramedics and EMTs. We do work hard to staff ambulances with 2 paramedics during the initial orientation of a new paramedic for at least the first year, hopefully. But so what I'm saying is we want to find, recruit, and retain more paramedics and not have to use as many underfill EMTs.
I understand that. I guess my question would be, say you're down 8 staff. Are there not EMTs that we could get to fill those 8 positions?
Well, we do have several in the pipeline, as you say. We just did another orientation class last week, but we're actually hiring them about as fast as we can. So there's a bit of a shortage of EMTs as well. Qualified EMTs, I would say, that meet our criteria and pass the orientation process.
I guess the way I would describe the mixed goal, again, I think we have intentionally moved towards crews that have 2 paramedics. But to the extent there's not paramedics available, another option is a paramedic with an EMT. And as much as we need to do that to get full staff,
Mhm.
that needs to be welcomed And again, there are people out there that can do these positions. One of my concerns is, you mentioned it just briefly, but what about status 3, status 2, status 1, and status 0? And just make for my colleagues to understand. But a status 0, I mean, there's not an ambulance available for the next call.
Correct.
And status 1 means there's one ambulance somewhere in Sedgwick County that can take the next call. And on it goes. We don't want to ever be in status 3, 2, 1, or 0. But when you're status 1 or status 0, you're vulnerable to, say, the only ambulance may be on the far side of the county, and that you got to rush across the county to get to the next person that's waiting. And so how often are we hitting those statuses daily?
Well, so we're unfortunately missing an important piece of data, but because we're averaging 2 per day, but the
For
piece
what?
of
To what?
two status events per day. So we're either at status 3, 2, or 1 twice per day on the average. However, the missing piece of information that we're not able to capture with our system is the duration of those events. They could be for 30 seconds, 5 minutes, the duration is generally small. But, in other words, ambulances could become available rapidly. And so you're no longer in status, as we say. So, and Angela's got some better numbers on that probably.
So the best tracking that we can get is from the alerts that we get from our 911 system, which is a manual process from 911 to us, and going through those email notifications, putting them in a spreadsheet, and then trying to track them the best that we can. So I have information that goes back to around the 21st of January, and I can tell you that the highest number of status events that occurred were 13. But again, that could be status 3, 2, and 1, all within a 5-minute period. We don't have the ability to track how long, how many times. I mean, we can look at how many times a day, but when you look at it that largely, it's hard to compute how many times and what the duration is. But
I know your software changed a while back. I think when Paul Masasi was here, we were able to get this data better. I don't like not knowing the details here. And then, again, are you saying you're not getting to status 0?
we are sitting status 0, yes,
Okay, so let's be clear. We're getting status 0.
we are.
And you said up to 13 times in one day.
13 times status 3, 2, or 1, or 0, or 0. I can break it down if you want the raw data. I'm happy to send that to you.
I think that this is, again, I think EMS had a bit of a crisis we worked through back in 2019, roughly. We have done a lot to address as many things as I could possibly address, trying to encourage this department to, I guess, to become as efficient, but also as responsive as needed. And I don't think this commission has been reluctant to provide, enhancements to make this EMS program as good as possible. And I think overall things appear to be better than they were, but I'm still saying, here we are in 2025, talking about 2026 budget, and status 0 is still a discussion. I don't know that that's, I think back when Scott Hadley was here a long time ago, we hit status 0 maybe a couple times a year. It almost never happened. So I know call volume is up. Call volume is up, but I guess I'm wondering, you talk about adding one ambulance right now. Again, if we had the staff, I don't know if you guys can, again, if we don't have enough paramedics, split those paramedic teams up and get some EMTs alongside of them and get some more crews on the street. I don't know why we're not doing that. I don't, Mr. Manager, is there something I'm missing here?
We're looking at alternate ways to achieve the goal of as many less status events as possible. If you look at our staffing table and you look at the amount of responses that we've increased each year to year, we don't add that many resources. I don't know that we've probably added the resources each year to keep up with the demand. And the graphs that we provided you show you what that prediction is like over the next 5 years. We are exploring other alternate staffing models. And I mean, be assured that we're thinking outside the box. We're looking at other ways, and I don't know how.
I don't know why we have not, I guess, enhanced our number of trucks on the street, number of crews that are able to respond. even years ago. Again, I know you said you're adding a little here and there, and I agree, things are going up slowly. But I don't want to solve it at this rate. You're talking about numbers out to 2028. I'd like to solve it in 2026. I think I'm not content to sit back and, be criticized by the public who are, sometimes they hear, again, it doesn't just take one bad call where the narrative becomes viral almost, where people hear about something that didn't go right because someone, some response didn't happen the way they think it should happen. And then those stories are repeated and maybe even embellished. But at the end of the day, it makes us as a organization look like we're not doing what we're committed to do, which is provide to the best of our ability the right response. And I can tell you there's a lot of dissatisfaction in District 5. And I don't know what to do with that. But Mulvane has a EMS system, and they're running out into my district to provide responses when we should probably be out there, and we're dependent on them when we probably shouldn't be. And so at the end of the day, there have been some narratives between 911 and getting the call answered and getting it dispatched and then someone showing up. That entire event creates opportunities for criticism to us in numerous ways. And I guess I just don't know what it's going to take to get this fixed. And I think having more ambulances is probably reasonable. I don't, talk about adding one. I would like to see these 8 positions filled immediately, and I'd like to see the other 6 positions probably filled. I think we can justify that. But you're going to have to understand that the mix might need to be a paramedic and EMT until we find more EMTs, but that's okay. We did that way for years on purpose, actually. It's not ideal, but it is a way to get more people out to provide responses. And it's my personal opinion, that's what we need to do here. A couple more quick questions here.
Just one comment on the data. We fully understand the importance of gathering that data, and we're actually in the process of interfacing a new program with the current CAD system to try to capture that. So that's in process.
Okay. And for these 21 graduates we had for the E2P program, are all those 21 with us still?
Yes.
Mm-hmm. The initial rollout of the program had a 3-year commitment. We changed that to 5 years. So.
And that costs us per student a total of about $30,000.
Correct. About $30,000. And that includes backfill costs while they're attending school. So that's
that means when they're in
tuition.
class, we're paying them the hourly wage, plus we're paying the tuition.
Yes, sir. Yeah, it covers tuition fee, and they're full-time employees. They get paid full-time wages during the program.
How long does this program per student last?
It varies by college. Some of them are around 12 months. Some of them are around 18 months.
So let's say doesn't Cali have a program?
Mm-hmm.
Is that 12 or 18 or is it both?
Both. They have various programs.
How many hours during the week are they working while they're in the program for Sedgwick County?
Well, I can have a breakdown of it if you give me one moment here.
They have different phases of their schooling. So during phase 1, they have more class time, which is fairly minimal, which means they're able to staff a truck more often. And then by the time they're finished with their phase 4, which is their field internship, they're essentially working a full-time shift on the truck as third person for 3 months.
One more quick question here. The vehicle, the SUV that you're getting, is that for both of the 2 people that are doing the mobile integrated health? Is that 2 people for that one vehicle?
Correct, because they would be working, 2 shifts. So
Different times,
same vehicle.
If I did my math correctly, the number of calls for these high utilizer calls, you are looking at about 1,740 calls per person. The numbers you gave me, and you do the math, that's 1,740 response calls that we're trying to address with one person. Again, if you get that reduced sum, I guess you're saving some. I'm not sure you're going to save it. You're not going to probably solve it entirely. hopefully you'll reduce that down, but the total number, you said you had 278 people times 10, and of the 278, 70 of them had times 20. So you do the math. That's a total of 4,800 and well, there's 3,480 calls collectively. Divide that by 2, that's 1,740 per person. So again, we're trying to reduce 3,400 calls with 2 people. I don't know how well that's going to work. I mean, it's an idea. And by the way, there's no reimbursement for those calls. Is that correct?
That's correct. And, you know, we don't want to take away from our staff on the ambulance either. So that's why we're trying to, you know, address the issue as much as we can without depleting any personnel from our ambulance staff.
I wholeheartedly agree that moving the paramedic from ICT 1 to an actual response team, that's necessary. I think that needs to happen right away. And then I had one other comment. I'll see if there's other questions I have. I think I have one other comment, but I'll find it real quick.
Okay. I think I have more of a comment than anything. It's quite apparent to me that the call volume is going to require you to scale. I get to see the reports that you send, Angela. Thank you. Not only just on the status, 0, 1, 2, and 3, but also ambulances that are off track. Some of these are in my district in Mays. We hear about it frequently in Valley Center, Park City. And it's because of pulling things to the core where the call volume is. I totally get it. So in my mind, I understand decision packages to say we need more ambulances, we need strategic, more resources in there. And I'm the one who's been pushing you and asking you to continue to explore this mobile integrated health model. I don't think I need an answer. I think I know the answer in my mind is I want to invest into that. But I think what's more urgent is you needing more units on the streets. I think that's what's more urgent. So I wanted to just publicly say that to you, that I'm the one who's really been pushing on the integrated health model. And I do think it would reduce a lot of tension and a lot of need on your department. But I think the priority in my view right now is the ambulances and the staff on the streets to keep us from keeping ambulances off track and the status 0 events. So,
well, I would just add that we're requesting 1 ambulance through this process, but we also requested an additional ambulance through our equipment fund.
Yep,
So,
I know that's coming. So,
yeah.
So anyhow, I know the graphs tell the story. I mean, I don't want anybody to think that the status 0 is a complaint or is it's an issue of operational issues. It's more an issue of the call volume. We're not keeping up the call volume. And I see that in the data and I see that in your response. So I want to be able to support that. Commissioner Howe, did you find that question?
Yeah, I did. So you mentioned the threat being a decreased federal and state EMS reimbursements of Medicare and Medicaid. I have not heard that from anybody else. I know from some states that have expanded Medicaid, there is some talk about that. But in terms of federal and state reimbursements for Medicaid and Medicare patients in Kansas, as it sits right now, I've not heard. Does anybody know a threat, a discussion about reducing the support for Medicaid and Medicare patients in Kansas from federal or state government?
There has been discussion that we've heard about that there could be reductions to Medicaid. But it has been so speculative. And then other times we've heard that's absolutely not under consideration. So in all honesty, I have no idea what to tell you.
And again, on the states that make expanded Medicaid, I think that is a threat for those that population specifically, but for other people who are otherwise qualified, disabled, or elderly that are unable to provide for care. Those Medicaid patients, I've not heard of anybody. So I guess I want to make clear, I don't want someone to feel like they're going to lose their medical care because that would be terrifying. This is like taking away Social Security. Oh, it's just, I don't want rumors to get out because of someone misunderstanding the comment here. I don't know where that came from. I'm not worried about that piece of it. I think that we need to let people know, as far as we know, that's not going to change. And if someone has data on that, I would love to hear it. If I'm wrong, please let me know.
I just wanted to follow up on one point where you asked about the E2P program. I don't have the numbers in front of me, but there's an attachment in the decision package that has it broken down by the various programs and the hours spent in class versus on an ambulance and backfill. So it's itemized in that attachment.
It is. I saw that. Thank you. Okay. Appreciate the presentation and the time. Lauren, how we doing?
So, what's left? So we're going to fire next on page 278. We have to stop at 315.
Okay.
Can you do it? Okay.
Chief Nelson, good to see you.
Yeah. Okay. I'm Kevin Nelson, Deputy Chief of Administration for the Fire District. Chief Williams is unable to be here today. We'll get through this. So our staffing, I'm glad to report is up to 100%. We're going to graduate 7 recruits on Thursday of next week, and we will be completely staffed, which is great. Like EMS, there's not a statutory requirement for the fire district to exist or to provide fire service, but we do provide what we believe are some pretty essential non-mandatory services. So I won't read through the list through everything. One I would like to point out, the drone program we started a couple of years ago. We've had some really big wins with that recently. We were able to locate a patient in like a wooded area that was really hard to find, and then we actually assisted law enforcement with an apprehension. So it was the same person piloting the craft both times. Next, sorry. Okay, so our strengths, weaknesses, opportunities, and threats. Our strengths, as I mentioned, 100% staffing level. The residential and commercial development in the fire district, we have seen quite a bit of both. So we've used to think all the time we weren't going to grow. Now all of a sudden we have a lot going on in the fire district. So it's a good season for Fire District 1, I can tell you that. Some of our weaknesses, we're not able to complete recruit and operations training without the assistance from other fire departments. We're not able to conduct live burn training. We don't have facilities to complete that ourselves. We have some plans, hopefully, to address that in the near future. Another weakness is dependence on property tax revenue. In the state of Kansas, as a fire district, our only opportunity to collect tax at this time is through property tax. Opportunities, as I mentioned, explosive growth in the fire district. Park City, where our admin is located, has a lot of stuff going on. I know Goddard and Mays, a lot of things, especially residential. They're expecting huge increases in population over the next 10 years. So there's a lot of stuff going on there. We have an opportunity to increase the number of advanced medical providers in the fire district. Last year, the commission approved I don't know what the correct term is, Sheena, but more pay, advanced medical provider pay for advanced EMTs and paramedics. So we've already seen 4 more people that are going through the process to become advanced medical providers, and one of our recruits is also an advanced EMT. So we're seeing increases to that, which will lead to increased service levels in the fire district. The threats, again, tied with property tax. So as a district, we have some concerns with the desire to lower the mill levy while there is a potential cap going to be placed on property tax valuations potentially in the near future. And then we understand the push to lower the mill levy. We're not against that in any way, shape, or form. We just currently in the state of Kansas have no alternative revenue replacement. And when you combine both of those two things together, it becomes somewhat of a possible toxic mix for the fire district. If we lower our mill levy and then we get capped, we could see some troubles in the future, potentially. This next slide, typically we wouldn't necessarily even need this. All of our stuff is fire district general fund, which is separate from the county general fund. We did receive a grant this year. That is to purchase some dual certification wildland firefighting gear. We just got everybody sized for that, so we should be getting that later this summer. So that's why that goes away after this year. Next slide. The significant things on here, debt service goes up. We're going to take delivery of at least 5 fire apparatus this year, which will increase our lease purchase payments for the next few years on that. So that's why we have an increase there. Commodities goes down because we lose that grant. And the equipment fund is dropping because we have purchased quite a few staff vehicles and brush trucks over the last few years. So our need in 2026 will be slightly reduced. So we have one decision package, and that's a request for a full-time fire recruit training officer So we did get a training officer last year. That's a department-wide training officer. What we're asking for is a fire recruit training officer to focus on the training for brand new firefighters. Okay. Our current model, we have to take somebody off the floor to do that. We take them out of their station, off of their crew, off of their normal life schedule, put them on a 40-hour work week and have them train, recruit firefighters. And they do a really, really good job, right? So we're not requesting this because they don't do a good job. We're requesting this because it'll give us the opportunity to keep our crews intact. We don't have to pay overtime. By the time we get to having an academy, we already have at least 4 vacancies in operations. So if we take another person off, now we're up to 5 vacancies in operations. So just increase our overtime cost by pulling somebody off the floor. But having somebody dedicated to that position would also allow us to kind of analyze our training, our methods, go and look at other departments, see how they're training, some of the similar departments. So we would get people that would be really professionally trained as instructors. We'd get professional qualifications. We'd start to be able to meet some NFPA standards for fire training officers and things like that. So. As mentioned, we got one decision package for that fire recruit training officer. That is it.
Okay,
Any questions?
pretty simple. Appreciate that.
Was that 5 minutes?
Any questions? You're that good. Look, Chief Nelson.
No,
Oh, I was wrong. You're not that good. Commissioner Howell.
so just, I'm looking at the center column of your org chart and, am I reading that right? You have 5 deputy chief admin. You have a medical training work comp officer. I don't know what that person does.
They're a medical officer
Okay.
who also has to do our work comp for us as an additional.
Is there any way we can use Dr. Brinker to fill that role?
I can't answer that question for him.
But we have admin charges between the county and the fire district. So if you guys need services, I think there's a way to do that. I'm just wondering.
I think if you explain the role of the medical officer.
Well, and I think the reason that shows up as a work comp officer, because obviously we have somebody injured. Our medical officer as a paramedic has a higher level of training. He's worked in hospitals before. He has a really good understanding of the work comp process. He's able to get us directly into evaluations that sometimes we wouldn't be able to get to. But he does all of our medical training, hands-on training. He manages our advanced care providers now. So he has a lot going on. But work comp is just one of the things that is in his
Then your
duties.
package 1 is for another training officer. You already have 1. You want to go from 1 to 2.
Correct.
Okay. And then admin support, you have 2. Has it always been that way? I don't.
Yes,
It has.
yes. That's essentially yeah, those are civilian positions.
What kind of admin do that? I'm just curious, what are they doing for admin?
Well, one is, I don't want to say typical admin, but answering the phones and routing calls and taking messages and greeting people when they come in with deliveries at the admin office and stuff like that. And our other civilian member does a lot of our like paying the bills, creating POs for our battalion chiefs when they have things we need to buy for the different projects they manage and stuff like that.
Okay. And then I guess in the CIP discussion, we'll be talking about training facility. That's later. Thank you so much.
Other questions? All good. Thanks, Chief.
Thanks.
Rusty, what do you want on timing here?
Did I do 9 o'clock tomorrow?
Well, who do we have? We have Steve's here with corrections. We have Chris is MABCB. I hate that they came here. I hate that, but we have a hard stop, right? I mean, for the event.
I will not be here.
Well, we'll have Steve Stonehouse. So we'll do my sincere apologies if the people that came here, we couldn't get you guys in. Went long on the commission meeting and then, I mean, I hate that, but we have this hard stop on the event, so.
They were excited to be here to support their peers.
That's good to know. Appreciate that. Okay, Adrian. So tomorrow morning, 9 a.m. Oh,
Who's Adrian?
Lorian, it's been that kind of day. I looked right at you and
Hope runs budget.
I know, I've called everybody.
Adrian,
Rocky Balboa.
not our banner date, Dave.
No, it isn't. I've called you by your right name about 1,000 times and
Are we looking at, you want to start at 9 o'clock? You want to start at 9:30? You guys have, I mean, what do we got? A couple of hours here yet, probably, Rusty, or an hour or two? How much do you have?
Like 45 minutes.
Nobody has any precision packages to speak of. Talking maybe 30 minutes.
Of presentation and then time for questions.
Rusty, we do have our advisory board meeting at 9 o'clock tomorrow.
Oh.
So we should be, usually we're done, we should be here by 9:30 though.
want to do 10 if it's not that much. I mean, we have we blocked, it looks like commission calendars are blocked starting at 9. Do we want to do 10? So